Hi, I'm Dr. Shikha and in conversation with James Maskell. He is the celebrated author of the book Evolution of Medicine. He's also been talking about community and healthcare and also functional medicine. So James, it's a privilege to have you here.
Great to be back on the show. I love India.
Thank you. We all love India. So tell me that you had talked about the 4 P's of healthcare.
Yeah.
And tell me a little bit more about what are those special
If you go to the smartest people in the world in Silicon Valley and what they see as the future of healthcare, they'll talk about P for medicine.
Right.
So that is personalized, right? So rather than healthcare for the average human, what is the best healthcare for you? They'll talk about predictive. Can we predict disease before it happens and head it off before it does? Its P is preventive. So it's how do we prevent future disease? And then the 4th P, which I think is the most important of all of those, is participatory. So how do you participate in your care? It's not just about taking the drugs that the doctor gives you, but it's about sleeping properly. It's about exercising. It's about how you eat. And it's about having a strong sense of community and having healthy friends. And so ultimately, that vision is P for medicine. And the reason why I'm excited about functional medicine is because that's a way for doctors to practice P for medicine today.
It's interesting because in your piece there is no pill, and it's amazing because as doctors you only think of the pill and you know. So what you're also saying is in the patient participating with the doctor, they're taking ownership of the healing.
Yeah, and it's a bit of a change for people, right? Because they're used to the doctor taking care of them. And in the old medicine, where things happen to you, like an accident or an infection, the doctor was the most important person because they had the toolkit, they had the drugs. Whereas in the new medicine, because the diseases are lifestyle driven, the patient is the most important person. And so if the patient's the most important, the locus of control exists within the patient. And so part of this transition to functional medicine is education, like we're doing here today, because people need to know that there's no way that you can out-medicate a lifestyle-driven chronic disease. If you really want to get to the root cause, you have to participate. And just, can I give you an example with type 2 diabetes, right? So type 2 diabetes I know is a big deal here in India. And to sort of lay type 2 diabetes in that P4 approach, if you line up 10 people with type 2 diabetes, what you see is that maybe 5 of them have it because of diet. Right? And 3 of them have it because the toxicity in the air leads to dysfunction that stops the insulin sensitivity and starts to wreak havoc there. And 2, let's say it's a combination of other factors. So in Western medicine, we would just say put them all on metformin, give them all insulin. Right? And what you can see, can you intuit that isn't a real solution? For the people who it's the diet, they need to change the diet. Yes. For the people who it's the toxicity, they need to do the clean program, they need to go through the detoxification process and get healthy. And then for these other 2, we need to do a real investigation of what's going on in their life. Maybe it's community, maybe it's sleep, maybe it's all kinds of other things. It could be that their father or grandfather worked in a coal mine or had a very dirty job, and that passes down through the generations. So ultimately you can see in all of these cases the patient's going to have to participate. We're going to personalize the treatment to the person, and then we're going to try and prevent future episodes of type 2 diabetes. And we're also going to make it easy for people to participate in their care. So this is the way that healthcare is moving. And ultimately, I would love to help India sort of wake up to the new reality.
It is fascinating because an incident comes to my mind. I was working on a project with a major heart hospital in India. And at that time, my thought was that people who are overweight, obese, and who didn't eat well got heart attacks. And there I met a retired general who had had a heart attack because he was just so anxious and angry all the time. And there were other contributing factors which included that his kids were not with him, and there were other issues. So that's the first time I realized that someone who was eating well also could get a heart disease because of other factors which we were not trained as doctors. The second thing which you have mentioned is personalized. and preventative or preventive. Now, when you talk about personalized and preventive, that how do you personalize? Because normally when you go to a doctor, they say, okay, have a metformin, and then you just keep eating it till the time your sugar comes down.
Yeah.
How do you get the personal elements in healthcare?
I mean, first of all, as a doctor, you need to listen to the patient, and you need to have time to listen. And so, I've been thinking about different structures to give you that time. You need to listen to what's going on in the patient's life, and that's why, we've moved away from lifelong relationships with patients to short interactions, and that's some of what's been lost. So the first thing is to listen. The second thing is to understand people's uniqueness. Ayurveda has obviously the 3 different doshas that you understand that this person, the medicine for this person is good, it's not good for that person. That's a fundamental understanding that America and the Western world is missing because they don't have that foundation. And so that's why I'm excited for functional medicine to come to India, because ultimately it's very deeply ingrained into the culture already. So that's the basis of the personalization.
So 3 things you love about India.
Yeah, cricket. Definitely, number 1, can't wait there. I love the openness of India to this kind of medicine. And the third thing is I kind of love the chaos.
Oh,
right?
okay.
It's a little chaotic riding around, but ultimately I feel that out of chaos can come great things. I saw at the airport at Dehradun, it said they were doing some construction, and it said before great things happen, there's always chaos.
Yes.
And I thought that's very Indian, and I think that India has the potential to lead the world in creating a really truly integrated healthcare system because of those fundamentals, and anything that I can do to help is my pleasure.
Wonderful, James. India has the potential to lead the world in integrated medicine. A beautiful discussion yet to follow.